we have the questions now. Chloe is going to read the questions that you came up with regarding what do people want to know about Bear, correct?
Yeah.
Okay, what's the first question?
A lot of my skier friends have had ACL surgeries, sometimes multiple, over the years. Would Bear be a good option for someone who experiences any injury while skiing?
Yes, yeah. I think Bear's good for anyone. Obviously, to get back to skiing, it's time and criteria based, so it just looks different for a skier than it would for a lacrosse player or volleyball player, etc.
And skiing is the number 1 or number 2 cause of ACL tears in patients who have undergone Bear. It used to be number 1, I think soccer is number 1 now, but it's a very high number of people who've had Bear had a ski injury, so it's very good for Bear, yes.
How expensive are these operations?
Okay, I don't know the exact cost. I would say this. Most people's insurance covers it because the code for an ACL reconstruction is the same code for an ACL repair. A Bear is a Bridge Enhanced ACL Restoration or repair. So everybody's insurance is different, co-pays, co-insurance and all that stuff. Now, if you had to pay out of pocket, we do get people who come from different countries. It's definitely in the thousands. I mean, if you look at a knee replacement, that's probably about $30,000 to get done. It's going to be less than that, but it's going to be probably between $15,000 and $30,000, I would say, total out of pocket. You don't want to know how little the physical therapist gets paid or how little the surgeon gets paid, but that's a whole separate thing.
How big is the tunnel that is drilled to fit the Bear implant, and how does this heal?
Do you remember?
Was it 0.7 millimeters?
All right, so I just happen to have, actually, this is an ACL reconstruction model right here, but the tunnels for that, this is the tibia, the shin bone, the tunnel that you have to drill to put the graft into, this is a patellar tendon graft, is usually between 9 and 11 millimeters, so that's pretty big, like a centimeter. Same thing on the femur. The tunnel for a Bear is about 2.8 millimeters, so much smaller, less invasive, less painful, and there's no graft going through it. We're sewing the two ends together, so really the only thing that goes through there is the suture. So it's just something small enough to fit these sutures. So it's much smaller. Good question.
Have you ever killed a Bear?
I have killed bears in my sleep and usually hiking. My imagination goes wild, so it's one of those things that does go through my mind. How would I attack a bear in the wild? In my brain, I have never lost to a bear. Wow. I don't think that would be actual.
So somebody asked the question, have you ever killed a bear?
Yeah.
No, I have not. So this is what a Bear implant looks like, and these bears are too cute to kill, right? Don't you think? Okay, any other questions?
That's it.
Is this FDA approved or not?
Oh, okay. Is this FDA approved? You know the answer to that.
That would be yes. So it's FDA approved for anyone over the age of 13 years old with injury within 50 days, but Dr. P's done it on individuals younger than 13 all the way up into the mid-60s, as well as like I think 11 and a half months.
Yeah, it's actually 14 and older, right? So we've done 13 and younger, which would be considered off-label, which I have done post on that. You have to inform the parents and the patient that it would be off-label, but as long as it's something that there is a label for, it's approved, you can use it for off-label uses. It's just that nobody under 14 was studied in the initial studies, so that's why the FDA didn't approve it for younger. But in my opinion, younger patients is even better because they have open growth plates, and that drill hole is so small that we just talked about that you have less chance of damaging or injuring that growth plate, and you have a better chance of being able to completely avoid the growth plate by drilling in parallel to the growth plate with that very small tunnel. So yes, it's not on label for 13 and younger, but it is something that we can do.
One more question.
Sure.
That goes inside my knee. How do you get that in there?
Yes. People want to know, they've seen the picture with surgeons holding this thing up, and they're like, well, how is this going to get inside here? So, well, you don't drop it on the floor because that would be a problem, but it looks like it's not going to fit, right? As soon as you put blood on this, it starts to absorb it and it becomes almost like a sponge, and you're able to compress it right up into where it needs to go. So another great question. Thank you for your questions, and if you have any more, let us know.
Thank you.